Right-sided heart failure causes and symptoms. If a person has right-sided heart failure, it means the right side of their heart is not pumping blood to the lungs as effectively. The condition can develop if a person has already experienced weakness in the left side of the heart. Experts also refer to right-sided heart failure as pulmonary heart disease. In most cases, right-sided heart failure results from problems that have already occurred in the left ventricle. However, it can also develop if a person is experiencing generalized heart failure or lung disease. Blood can become blocked in the left ventricle and lungs. This puts extra stress on the right ventricle to pump the blood into the lungs. Over time, the right side of the heart can weaken and start to fail. This video will outline the characteristics of right-sided heart failure. It will also discuss its causes and symptoms. What is right-sided heart failure? When a person experiences heart failure, it means the heart muscle is not strong or flexible enough to pump blood throughout the body. The right side of the heart takes deoxygenated blood that has already been through the heart and pumps it out into the lungs. The lungs then replenish it with oxygen. In right-sided heart failure, the right ventricle of the heart is unable to pump enough blood to the lungs. This often happens due to a failure in the left side of the heart. Increased fluid and pressure then pass through the right side of the heart muscle and into the lungs. Consequently, the right side of the heart becomes weaker and damaged. There is also a buildup of blood in the veins, which can cause dispersion of fluid to surrounding tissues. This in turn can lead to swelling throughout the body, including the legs, ankles, abdomen, gut, liver. Right-sided heart failure symptoms. A person with isolated right-sided heart failure may experience the following: fainting, pain or discomfort in the chest, swollen ankles or feet, unexplained weight gain, feeling full after eating little, abdominal pain or fullness. Causes of right-sided heart failure. Right-sided heart failure can be due to the following conditions: left-sided heart failure. Left-sided heart failure is the primary cause of right-sided heart failure. When the left ventricle is not working as effectively, fluid pressure increases and ends up moving back through the lungs. This can cause an overload to the heart's right side. Consequently, when the right side is unable to pump blood, fluid accumulates in the veins, resulting in swelling. Pulmonary hypertension. Right-sided heart failure is the main consequence of pulmonary hypertension, which is when there is high blood pressure in the blood vessels that deliver oxygen-rich blood to the lungs. If there are changes in the small blood vessels inside the lungs, high blood pressure can occur in the right side of the heart. As a result of the added strain, the heart has difficulty pumping blood to the lungs. Chronic conditions such as pulmonary embolism and chronic obstructive pulmonary disease or COPD and diseases that cause difficulty breathing, including chronic bronchitis and emphysema, can cause strain on the right side of the heart. Congenital heart conditions. Abnormal heart function can result from structural heart conditions that are present at birth. Conditions may include abnormal heart valves, abnormal blood vessels, improper formation of the heart. These conditions may affect how blood flows through the heart and to the rest of the body. Pulmonic stenosis. A person with pulmonic stenosis experiences a narrowing of the pulmonic valve. This decreases blood flow out from the right ventricle, which then needs to work harder. Similar to chronic lung disease, this extra strain can cause the right ventricle to fail over a period of time. Other possible causes Other causes of right-sided heart failure include valvular heart disease. If one of the four heart chambers is damaged, this may prevent the heart from pumping blood the way it should. Sleep apnea. People who experience sleep apnea breathe differently when they sleep. This can increase pressure in the left and right ventricles of the heart and lead to right-sided heart failure. Carcinoid heart disease. Tumors in the heart usually affect the right side. This then can cause right-sided heart failure.